Let's go ahead and do the approval of the minutes for April 23rd, 2020.
I move approval.
Second.
A second.
Okay, all in favor, say aye.
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 Aye. Okay, minutes are approved. And now let's turn to the issue at hand regarding the state of emergency and the COVID-19 outbreak. The communication process with the Jackson County Health Department. The issue at hand is one where it's been expressed that there have been a number of, and as noted in the letter, there have been a number of incidences of communication with the Jackson County Board of Health, and they have not responded favorably with information, and in many cases haven't responded to even acknowledge the receipt of questions or the seeking of information. And so that communication is not, I think, a good way to be developing our new relationship with the Jackson County Health Department. So there is some interest, I believe, in considering that if it persists, then the idea would be that maybe we should consider reestablishing the health department, maybe not in its the same level as what we had before, but we would still be able to have a health department, a smaller scale, but have the opportunity and the ability to get the information that we need when it's important to have it. And so that's what the letter's about roughly. And if there's any other comments, you're free to jump right in and share your thoughts and ideas about this issue.
Hey, Jason White, and I at our last meeting, I went in knowing that all hadn't been particularly smooth, but I didn't realize the depth of the disengagement between the county and the city. We don't go through pandemics very often, and I know, like most of my neighbors and you all, we're in this household, we're taking it seriously with social distancing and staying at home and wearing masks, and I'm very thankful for the effort that's been put in by the system. I have a mother and a mother-in-law in nursing homes, and they shut those down to visitors. That's disappointing. And same with a hospital for my in-law. And yet they are safe, and I have every expectation that they'll remain safe during the tenure of this. So I was very surprised and extraordinarily disappointed when we kept asking city staff for information that is really basic for our city leaders to have for making good decisions on behalf of the 118,000 of us that live here. And I don't claim to be particularly knowledgeable in this arena, but my career's been in the emergency services environment, so I guess I got a touch of a feel. And I was extraordinarily surprised. And as I do what I do for a living, I have visited and I've now asked folks in other counties, and they seem to have ready access to information on numbers of people in their community tested, positive, hospitalized, and have passed on, and over time. And so they can look at that data and identify hotspots and identify trends to make broad policy decisions. So I was really surprised at the level of disengagement, and I was very disappointed. I opposed the elimination of the health department in the beginning, but it had already been done when we found out about it. It was done for budgetary reasons. But I thought I think we all went into the new arrangement with a positive approach. I, be very transparent, was very unimpressed with the county health department pretty quickly because of childhood vaccinations. I think there's a couple of things that our public health world ought to do really damn good, and that's one of them. And I thought, instead of solving problems so they could engage with institutions as our other health department had to make sure they were maximizing childhood immunizations, they were coming up with pretty bureaucratic answers why things didn't work. And I like problem solvers because the world's complicated and they didn't solve problems. They just quoted verse. And then I got more upset when just trying to register the foster kid I had. And I've told this story before, but it's part of where it gets me to my conclusion. I was disappointed that I couldn't get him registered for a simple shot. And I had to fill out a whole bunch of really inane questions that were inappropriate for the moment. And when we asked them about them, again, it wasn't problem solving. And if you've got families in lower socioeconomic that are struggling, and then you give them a complicated process to engage, you lose some of them. You lose a bunch of them, I suspect. And they weren't interested in solving the problem. So again, I sort of come to this conversation a little biased because I've not been impressed. I think we need to, I think Dr. Ruckman's letter is very appropriate. I think if I had been asked to author it, it probably would have said, I think we need to get the health department started in Independence yesterday, because I'm not sure the competency of the Jackson County Health Department in this pandemic. And this is a real threat to some of my neighbors and some of my loved ones in institutions. So I take this seriously. After our Board of Health meeting, I visited with other folks that I consider to be opinion leaders around town. Didn't do any scientific survey, but I found an awful lot of people that thought we shouldn't have gotten rid of our health department to start with, and they had heard of troubles, or they were in the mix and were well aware of the troubles of communication. We're now 6 weeks into this, and we're still having trouble communicating. So if the county had been interested in resolving the problem, it should have been resolved before we even had our board meeting 2-3 weeks ago now. And they certainly haven't taken any steps to substantially resolve it since then. So I would put my vote in a strong yes, and thank Dr. Ruckman for writing it. And I'd probably nudge him and say, it's a really nice letter. And I probably put in some more letters and words in there because I think I've got a stronger opinion of it's time to reestablish our health department for the protection of our city. So thank you for letting me comment.
Thank you, Jason. Any other thoughts?
I'll just say that I found the lack of data disturbing. The new page on the Jackson County data sheet that they sent out actually had some somewhat frightening stuff on it. We had 2 separate outbreaks, one in Blue Springs, one in Oak Grove, I guess the other one was, with a mortality rate of 17% in those 2 outbreaks. But I really don't know from that there were 17 cases in one and 18 cases in the other, and I don't know if that was residents at those 2 centers, or if those were staff at those 2 centers, or exactly what that story was. I think that's important. I'd like to know what kind of follow-up I had done. I'd like to know what kind of changes have been done. I mean, there's just things that, as with this, you ought to know about those situations if you are a government agency. I'm not saying necessarily it needs to be on the nightly news like the one in Overland Park or Jackson County is, but we ought to know that. We ought to know why 2 zip codes are so much higher than other zip codes in the city. They're actually fairly low density zip codes, but anyway, there's just data that I would like to know so that the city can make appropriate decisions We just don't have it.
Couple of thoughts that I would like to put on the table in terms of testing. Where are we in terms of the availability of tests, and are we up to par, and are we meeting a minimum standard of testing so that we can be aware of where the problems are when they manifest themselves? That's just one question I would put out there.
So on the website, the link that I shared with their data set, it does now have, the total number of tests that have been performed for Eastern Jackson County, which hovers right around that 6,000. I can't remember the exact number, but it's between 6,000 and 7,000. Depending on what expert you talk to, the number of tests that we should be done weekly for your population varies from 0.9% of your population should be tested weekly, all the way to one person said 50%, which is extreme. South Korea and a few other countries that have done a really good job of tracking and containing the virus test right around 6% of their population weekly to be sure that they have a handle on it. So roughly 1% of our population would be about 1,200 people per week for the city of Independence. If you look at the numbers, of course, there's 6,000 total for all of Eastern Jackson County, and that's for the last 2 months that this has been going on. So they're nowhere near that number. If you wanted to go with the 6%, you're now looking at about 8,000 people in Independence alone that should be being tested weekly. Again, we've only had 6,000 for Eastern Jackson County for the entire 2 months. So I would say that we are woefully behind on testing, that we need a lot more testing in order to be sure that we have it under control. Their website does show that only right around 6% of their tests, maybe, close to 7% of their tests are coming back positive, which is good. But with such a small sample size, I mean, I can't rely on that number as being an accurate number.
Okay.
Have we had any testing sites in Independence? When I hear it on the news, it's Blue Springs and other parts of Eastern County, but I've never heard one in the last couple of weeks of being in Independence somewhere.
Yeah, we actually had 2 in Independence yesterday.
Okay. That the county did?
Yes, the county actually did one on the square in the parking lot near the courthouse.
Okay.
And then they did one that was it was more of a closed group. It was for essential workers only. That was at the arena. And that one we sent out the invite, and I hope they took advantage of it, to all of our long-term care facilities, encouraging them to have their staff come and be tested.
Okay.
Because they have been complaining that they can't access the tests, especially if they're asymptomatic. They can't get a hold of a test. So we encourage them to try to attend that, and we've reached out to the county to ask if there's any way. I know I've been told that they're supplying tests to the 2 sites with the 2 outbreaks that are there on their website. We're asking, is there any way they could get a hold of more tests in order to supply it to all of the long-term care facilities in order to ensure that those staff and those residents are safe? But we have not heard back.
Yeah, the county website actually doesn't mention that one yesterday. It says there's one tomorrow at Blue Springs High School. There's one Monday in Raytown, one Tuesday somewhere in KC-Mo, one in Oak Grove on Wednesday the 20th, one again KC-Mo on the 20th, and Delta Woods Middle School. there in Lee Summit off 291 on Friday the 22nd. It's pretty random testing, and then there's a phone number you call to get tested. So I'm not sure what the criteria are that the county's using, and it doesn't mention that anywhere on the website that I can see.
Their criteria for testing, if you call the number or if you go through their website, they want to know if you're symptomatic. And if you're symptomatic, then one of their nurses from Truman Medical Center reaches out and determines whether you meet their threshold for testing. The one that was for essential workers yesterday at the arena allowed whether you were symptomatic or asymptomatic to be tested. And we've been pushing for a lot more of those. But at this time, I understand that they are limited on the number of tests and the number of staff in order to conduct those.
That kind of brings up one of the points that we talked about last meeting, and that's the idea that we had some offer to help with some of the situations where if they were running behind or weren't able to get to some things because of not enough staff, and that as well was not received with any enthusiasm or interest. And so, I understand that, the training and everything that has to go on, but it just seems like getting a cold shoulder, so to speak. And that just doesn't seem to make this relationship work as far as any interest on our part. It tends to cause, I think, a distancing. But anyway, and I had one more thought. Has there been any effort to directly talk to the Board of Health, specifically by the mayor or anyone else, or is it all the communication with Jackson County by phone or by through the legislature or the county executive? What effort's been made to actually try and resolve some of these issues as far as the communication that we really want to establish? So have we sent an emissary or anybody out to talk with Bridget? Or
I can promise you that there are multiple committees that meet to discuss this, that Jackson County Health Department serves on, and our staff serves on, or our elected officials serve on. And there's like the MACG, the multi-agency coordination group, meets weekly, and there are offers every single week for assistance. Our PIO, our public information officer, meets weekly with the county. Well, I guess I should say meets virtually each week with the county and the other PIOs for Eastern Jackson County, and has repeated offers and asked questions, asked for additional information. We have our stakeholder meeting that we hold 3 times a week that the county is invited to each time. And we ask for information. We send emails. There's phone calls weekly with the Jackson County mayors and city managers. That includes the elected officials for Jackson County. And there's repeated requests for information. I mean, yeah, we try repeatedly every week. There have been formal letters sent. There have been, emails sent. I'm not sure what more at this point we can do.
Dr. Ruckman?
yes.
2 quick points. One, I'd like to sort of touch on your comment on the contact tracing, because when that came up at our last board meeting, I thought that was really a neat idea, that our fire department and 2 the other large fire departments in Eastern Jackson County had essentially offered use of their paramedics to assist with the contact tracing. And I looked around, and so apparently there's a 6-hour online CDC class on what you absolutely have to know, but utilizing people that are used to asking health-related questions in a rapid sequence kind of environment, I thought was really nice. And the recognition that those entities were going to bear the cost. And I think within 3 days in the newspapers, so not told to our city leaders, but through the newspapers, the county had indicated they were looking to release a $5 million grant to do what the 3 biggest communities in eastern Jackson County had offered with available staff that were medical professionals as a core baseline to do. So I haven't heard or seen anything successful yet in the way the county has worked with our city in response to the pandemic. So I think that all continues to add weight to the need to sever the ties and move back to where we were and have our own health department. Thank you for letting me speak again.
You're welcome.
I had one more thing. I'm sorry. So following up on Christina's comment, I did, after our board meeting, I did query, as I mentioned, various opinion leaders, and I don't know whether they're ready to get on one of these Zoom or GoToMeeting things and prattle on. But there's an awful lot of folks that are in administrative or elected official roles in the City of Independence that are very frustrated, exactly following what Christina has outlined in their efforts to try to get good information so that they can collectively make good decisions. So I think we're having a public conversation about it, but you don't have to scratch the surface very deep to find people in official roles in independence that are more frustrated are very frustrated about this failure on the county's part. And I think they're looking for some solutions. And I hope they will seriously take a look at this potential for improving our public health situation.
One thing we can rest assured that based on the recent historical trend, when you look back, China has introduced us to the bird flu, the swine flu, a number of others, and now this coronavirus is the latest. And so I honestly think that it's not over. We're going to have more episodes just like this one because of the way they do business over there. And I really think that, you know, if we're looking at this issue with any sense of sincerity, we either have to come to a common agreement on the issues that we're concerned about with the county. And if we can't, then I don't see where we have a lot of options to, you know, in terms of this particular conversation. There's, I don't know.
Hey, Christina, Daryl Nelson. What's the likelihood of this panning out in the current state of the city government's economics and your administrative structure? I mean, I know you maintained in a somewhat of a different role. And I guess the main reason I ask is and maybe Ralph's already discussed this, but if there's not a reasonable likelihood it's going to be able to materialize, do we go ahead at this juncture? And I appreciate everything you articulated that's been tried with the county, but I guess I would just want to make sure that kind of once we fire what sounds like to me kind of like the final shot, that we've got a potential to be able to do something ourselves versus try to muddle through a situation that I certainly concur isn't by any means healthy or beneficial right now.
So, I mean, I can't speak with any certainty. I can tell you that there are major hurdles that would still be ahead. Economically, you know, funds are not flowing into the city Everyone across the nation is being hurt. Sales tax revenues are down. Our normal way of doing operations, is down. Zach shared in his budget town hall that, GDP is down across the nation. Our sales tax is down. Because we're not turning people off on their utilities. I know this is going to be a shock, but a lot of people aren't paying their utility bills. So a lot of those funds are also not where they normally would be. So the economics of it will be difficult. There's also, just because we hire, the couple of people needed to form a health department to have all of those core functions in place, we would still need the state to look upon us as the local public health agency. That authority they would need to grant back to us. So we would need to still get past that hurdle also. I can't tell you that it's impossible. And I mean, it all depends on how badly different elected officials, in all honesty, want this to happen. And whether the state has the wish to also see it happen. There's different opinions right now that are floating out about whether other jurisdictions would support our bid to come back. So we'll have to, I can't say it's the rosiest of futures. I guess it's the best way to respond.
Thank you.
So as far as a conversation where this particular issue is addressed directly to the Jackson County appropriate people, I would say obviously Frank would be a person to talk to, and the mayor, I'm sure, and Zach would be the other side of the coin. And then from there, that would be the place that if it can't be resolved, then we would have to look and see what our options are at that point, whether or not we have the financial wherewithal to go back and reestablish what we just recently disassembled. And unfortunately, 2020 is the year that we're in, but 2020 vision is also, hindsight is 2020. And obviously, if we knew back then what we know now, we might have made a different decision. And so, but we can't really go back and change what's been done. So what we need to do is address the issue with it not lingering any longer than necessary. And that would be my first recommendation, to establish whether or not we can resolve the issues with a real official effort to make this go away if we can. But any other thoughts?
I appreciate your comments, and sometimes I get accused of pushing too hard, but I'd point out that 3 weeks ago, we sent the same request that our mayor and city manager had sent to the county and to all the county legislators. And we've not, as the Board of Health and Independence formed under the charter, we haven't even gotten thanks for the note yet. And to the best of my knowledge, the city administration still struggles. So I agree with your diplomatic efforts to try to get the ship righted. I'm not going to hold my breath waiting for that. I think Dr. Nelson hits on a real key. I'm not the most knowledgeable here in the group on the financing, and I've spent some time asking around again, what's the potential? Because clearly the model in the state is around county health department. some potential for conversation with other entities in Eastern Jackson County, because apparently we don't have the only city staff frustrated with the lack of communication with the county during this pandemic, and no predictions there. But the idea of how to reacquire the funding, and I'm going to call it state funding, and Christina may correct me, because I understand there's a bundle of dollars and some of them may be federal pass-through dollars that the state sort of assigns to health departments. That's all been reassigned to Jackson County. I think the evidence of their failure due to the pandemic would be a telling story in the proper environments in Jefferson City, and so I agree. We should have some expectation that we've got a shot. And as Christina said, I don't know that anybody can promise that. But one of my fears is, and I'm not the medical person here on the team, but this thing's going to cycle back around. I mean, we're not out of it yet. And if it cycles back around in the fall without a vaccine being available, I don't think we're ready by any stretch. And the county's not helping us be ready for the second round. And I would like to try to help light a fire under the decision makers. I think some of them are already very interested in trying to pursue this, and are looking to see what is the sense of the community. But I agree, Dr. Nelson, if we have a shot, we're probably into a long-term conversation to try to persuade the state to reassign those dollars to us. And Christina's going to have to do the math. But I think even if we got those reassigned, that doesn't plug the hole of what the cost of a health department would be. Now, we are fortunate. We still have a bunch of the nurses and Christina and Mike Jackson that have all that background, but we still need an epidemiologist and maybe an infection control expert or something. So apparently when we add up what we need, that's more than what we would get if we were successful in getting the state monies back. So there would be some additional commitment of general fund dollars. Having ratted around independence for a while, I suspicion the community at large was less than happy when we got rid of the health department, and I would change my term there. We didn't do that. That was in a city administration decision based on cost savings and bad budget times. We were not asked to advise on that. None of us were made aware of it until after it had occurred. But the sense of the community right after that was the department was eliminated, was not supportive of that decision. And I sort of suspicion as more people become aware of what the city's put up with trying to communicate with the county, we'd find pretty good support for this conversation I guess we're sort of starting. Thank you, Mr. Chairman. Sorry for talking too much.
Well, we're used to it, Jason.
I would share real quick. You had talked about if there was a chance for the mayor and Frank White essentially to discuss and come to terms. I don't know if any of you follow the mayor on Facebook, but just a couple of days ago, she posted a pretty long Facebook post, and she also did a link on her Twitter page where she talks about how there were real communication problems with the county and how disappointed she was at not having things communicated to her by the county and by Frank White. So, I mean, she is frustrated enough that she is more than willing to post those things on Facebook, which I think is pretty telling.
Ralph, I have a quick question. Just
Right.
has anybody talked with Blue Springs and Lee Summit, and are they having the same degree of discomfort with the lack of information that we're having?
By way of just casual comments, off the cuff kind of comments, I've heard that Blue Springs and Lee Summit are not happy either.
Okay. Well, those are the major cities in eastern Jackson County. And, if you look at St. Louis, all the data is reported as St. Louis City and St. Louis County. So there's nothing wrong with developing a system that would be Kansas City, Mo, and eastern Jackson County. It sort of exists with the data reporting that we have.
Well, the irony is that there aren't a lot of options. I mean, it's not like we can fire Jackson County and go hire another subcontractor, because they just don't exist. And so, that's where having our own is what it ultimately might come down to. But I don't know that there's any kind of option that would be that anybody ever has done somewhere else, maybe, but having a competitor to the Jackson County, and that's the other thing. Jackson County Health Department is not employees of the county; they're employees of Truman Medical Center, and so that weighs into the issue. And if we're not looking at being successful with the county executor, maybe the hospital is where the conversation needs to go, because they're the ones that we're paying, even though the county is the middleman. The Truman is the real source of potential for resolving this.
And I would share that our mayor sits on the board for Truman Medical Center, and she will tell you that she has been equally stymied at trying to get results out of the health department.
Wow, that doesn't bode well for this conversation. Any other thoughts or ideas? I hear the wheels turning, but I don't hear the lips moving. All right. Well, I don't think we need to belabor the issue at this point. We've probably covered the critical concerns. So at this point, if there are no other thoughts or comments, going once, going twice.
Do you want a motion to I assume, do you want a motion to have the board support submitting your letter to the mayor and council? Happy to make that motion and see where it goes. Is that what you're looking for, Dr. Ruckman?
Yeah, I was going to say the idea of going once, going twice, going three times. Any motions want to be made? And so that's where we're at, Jason.
Happy to make a motion that the letter is drafted by Dr. Ruckman regarding the city-county relationship with the health department be approved by the board and submitted to the mayor and council.
I'm happy to second the motion.
Okay, Terry seconds the motion. Any more discussion at this point? Hearing none, all in favor, say aye.
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 Motion carries. And Christina, we'll let you.
Dr. Ruckman, you procedurally need to ask for no votes and abstentions, sir. Did I get that right, Christina? Too many Zoom meetings.
Oh, that's fine. Thanks for being my keeping me on target here. So any okay, abstention. We don't have anybody that I think has voiced anything from that particular group. And what was the other category?
Yeah, just to make it official, who votes yes, who votes no, and who abstains.
Oh, so okay. Let's go ahead and go around the room. And Christina, I'll let you call the roll call and ask for their vote.
Can do. I don't believe he's on here, but Dr. Potts. Jason White.
Yes.
Lori Halsey.
Yes.
Dr. Morris.
Yes.
Shauna Jackson.
Abstain.
Dr. Wingert.
Yes.
Kathleen Bennett.
Yes.
Dr. Ruckman.
Yes.
Dr. Ruddy. Dr. Nelson.
Yes.
Okay. You have 8 in favor, 1 abstained, and 1 not present. Motion passes.
Okay. And any other parliamentary procedures, Jason? All right. Let's call it a night, and all in favor of going home, raise your
Could I ask
left.
one, could I
Go
ask
ahead.
one technical question? This is for the doctors or Christina. Use of masks, is that something the city or the county is going to say as part of the opening up that we all, my wife gave me the lecture a long time ago to wear the mask, so I kept her safe. So if I had the disease, so I get that. I'm wearing it for the people around me, but that's not been part of what I've seen as policy statements from government. Is there a reason for that? Or anyway, sort of an open-ended question for a technical answer, please. Thank you.
Well, I would like to suggest that our next meeting, maybe we should all wear a mask during the meeting.
So I will share that the city hasn't required it because the CDC just recommends it. So we follow the CDC's recommendation and their guidance. I know that for the city's own facilities, when we open back up, there is talk that we will require those entering our facilities to possibly be wearing masks, and for our staff, when they're interacting with any member of the public, they'll need some sort of PPE, some sort of protection. And if they're in close proximity to other coworkers, they'll be needing also to be wearing those masks. That's wise. We're following the CDC's recommendations, and they are just recommending it.
Okay. On that note, let's say
Christina,
goodbye. Go ahead.
I have a question. Is there anything the city is able to do, sending staff out, or maybe they have to the senior facilities to check on them to see what they're complying with? Are we able to kind of do some public health work without being with the code units or something else?
Yeah, so our long-term care facilities already are permitted through what used to be a health department group, but is now part of community development. When this started 2 months ago, they proactively went out to all of the long-term care facilities. They did not go in, they didn't try to make direct contact, but they did make sure that they were following safe practices, that they had all the information they needed. There's a group with emergency preparedness that has been checking in on them weekly, doing a group call with all of the facilities that they can get on to check with them to see how everybody's doing. Is there anyone sick, or do you have any concerns? Is there anything you need help with? We've also sent those same inspectors from community development have reached out again. I don't remember if it was last week or if it was the week before, specifically to ask them again if they were okay, and to let them know about the essential worker testing site at the arena. So we are trying to be as proactive as we can with our long-term care facilities, and to let them know that even if they're closed up right now, that we are there to assist them if they need PPE, if they need mental health resources. If they need something, we are there and we want to know. We do not want to make them feel like they are left alone.
Great, thanks.
Okay. Going once, going twice. All right. See you guys later. Have a
Okay.
good evening.
Bye.
Bye.